You know, it's funny, I've never had a CAT scan. I was never in the ER ever in my life. I've worked here for more than 30 years and it's home. But as a patient, it's really different. I got really short of breath, and it actually had been coming on for a few weeks and I ignored it. And when it, just kept getting worse and it was severe. So I finally decided to go to my primary care doctor. And she listened to my heart and she noticed a murmur. And she said, "You don't have a murmur, do you?" And I said, "No." And she also noticed that my lungs were not functioning properly.
In Connie's situation, the next to the last valve the blood goes through, the mitral valve, was not doing its job. It was allowing blood to go in both directions, allowing it to back up into her lungs, which resulted in shortness of breath. The next thing you know, she was admitted with congestive heart failure, a pleural effusion, and some heart problems that she had no idea she had brewing at all.
A cardiologist came in immediately and said, "You have a prolapsed mitral valve. You will be having open heart surgery later this week." I almost fell off the bed. There's no family history of heart problems. I have a healthy heart. The doctors think that I was born with that, and it just never caused any problems. Nobody ever knew it. I never had a murmur, and just suddenly something caused it to prolapse and caused me the trouble. Dr. Cardone came in and introduced himself as my surgeon, had a nice conversation about, what we were dealing with and what the options were. He's very patient, he's very pleasant, he's very willing to answer questions. I was admitted on a Tuesday and initially thought I would have the surgery on Friday. And because I had to have all the other workup, my surgery couldn't be done until the following Monday. And Dr. Cardone saw me Saturday morning and Sunday morning while I was in the hospital. And I thought, wow, my surgeon came to see me on the weekend, both days. I was really impressed with that. The outcome was he was able to repair my valve. I didn't have to have a replacement at all, and that's the best outcome.
She went home 4 days after surgery. She was able to breathe again, get off the oxygen, and like I said, she just rallied right up and went home. I
feel great. I've had no problems with my valve.
That's the whole reason we do this. That's the reason I'm here. That's the reason I do what I do. I get that gratification of a patient who really is able to reap the benefit of what I've learned over the years and what I'm able to provide. I can't even describe it. It's beyond words.
I received wonderful care, and I don't think it's because I work here. I really don't. I mean, so many people that you interact with don't have a clue that you work here. And so I was very pleased. I get all my health care here in this community. We have good doctors. We have good programs. I was totally comfortable with our heart program. I never considered going to a different hospital. I got really good care.